Hi everyone, I am Dr.RUkmani Choudhary, and in this video we'll be talking about Coccydynia. Coccydynia is the condition that is rare but we have to discuss as this is found cases. So Coccydynia will talk about everything like what is Coccydynia, how it occurs and who are at a higher risk of this condition, sign or symptoms, diagnostic part, test best effective homeopathy medicine prevention management. So you are requested to watch complete video for complete information, and if you're watching for the first time, don't forget to subscribe my channel and press the bell. What is Coccydynia? See, Coccyx is this last part of the spine, the spine vertebral column. So this is the last bone of that spine. And then what is the function of and why we should discuss about it? See, function, this is a very important part, and the function, this obviously, as this is the last part of the spine, so this provide a balance and the main support of the weight. So and this is a site for many muscles, like several muscles for and the ligaments, tendons for the insertion. So the important part. Now, what are the causes and how it occurs? Like, what is Coccydynia? See, Coccydynia is the condition in which you have pain in your coccyx, that tailbone. The tailbone, you have pain in that particular area, and that can be associated like with tenderness, swelling. So we'll discuss later on in the symptom part. A rare condition. So who are at a higher risk? Of course, the person who are obese, overweight, they are at the higher risk, and female are more prone. And the person who having their profile like they are bind for a long sitting hours. So obviously, and they are the using hard surface. Those person that of course they are at a higher risk. Now, what are the causes? The most commonest cause is like trauma and injury, any fracture, any trauma that leads to Coccydynia. And there are other conditions that resemble or misdiagnosed as Coccydynia. We must rule out or we must exclude, and I'll discuss this in the diagnostic part. So there are conditions. The first, let's talk about the injury part. Yes, trauma, injury, fall, blow, any sort of injury, that particular part, any hard, any blow, so that causes Coccydynia. And there are conditions like sciatica, and there is a condition again, the singeal, so in which you have rashes also. So we must rule out, and sacroiliitis, and at times fracture of that particular bone. So these are the causes of certain conditions that. Now the symptom part means the suffering you have. What are the clinical features you have in Coccydynia? Symptom part, obviously you have pain, and pain is like excruciating pain, unbearable pain you have at times, and at times there is a tenderness, means the area is very painful to touch, and there is a swelling and particular pain you have, and it is very discomfort for the patient. For sitting aggravates the it was the condition, it aggravates your symptom, and obviously the leaning forward bending also aggravate the condition. So these are the symptoms. Rest can depends on your case history, like what cause you have in your case. On a diagnosis part, diagnosis is made solely by your physical examination, your symptomatic collections, what symptom you have, and what are the findings. Is there any rashes, or you having other condition? So we must exclude, we must rule out other condition, like whether you are having singers, are there any rash. And at times, not usually, but at times, the CT scan, MRIs and USG can be done if the condition having other symptom, like there can be other disease. For that purpose, these tests can be done, not usually, but yes, can be. Treatment part. See, treatment again completely depends the cause part, and treatment is usually the conservative one, the symptomatic one, that what symptom you are having. So you are provided, if we talk about the allopathy part, they give you the corticosteroidal creams, the painkiller, depending on the severity and intensity of your symptom. Homeopathic part. See, there are several medicine in homeopathy for Coccydynia, means pain in your coccyx, but again it depends that what is your case and what peculiar is about your case. So homeopathy always focuses on your peculiar rare symptom that you have, an individual approach. Hypericum is the medicine that is known for the nerve or injury problem. Hypericum is a very good medicine. See, all these medicine, if you're watching on YouTube, you will find all medicines link on description box below. These medicine can be of different companies, can be in the different form, so you just focus on the medicine name. Company and form can differ, like by place. Don't get confused. Just look at the medicine name in potency. Start with the lower potency. So this is in the tablet form, and Hypericum is given when your case is like you have fall, you have blow, their injury history. So Hypericum works wonder in these cases. This is in the tablet form, so these are the bigger tablets. You can have 2 to 3 tablets, like without even water if you are comfortable, and if you are not comfortable without water, just add some water so that medicine get dissolved, and have it like before having meal. Before meal, just have it after having your meal. So this way, have this medicine like twice or thrice in a day, and just use it like till the time your symptoms subside. So this way you can use Hypericum. Rust talks, again, very good medicine and known for like any inflammation, any swelling, any discomfort, tenderness, stiffness. So this works again amazing when these are the symptoms. So you can use this medicine, and your peculiar symptom is that your first motion aggravate. Like when you wake up in the morning, there is an aggravation, you cannot walk, but once you walk constant period, then you feel better. Like drop form, so you can use with the help of dropper. Just have 1 or 2 drops direct on tongue, like having before meal or after having meal. Arnica again is given in like injury cases, when you have, again, there's a bruise feeling, when you have contusions, concussions, a severe pain. So in that case, you can use arnica, again in 30 or 200 potency, 1 or 2 drops direct on tongue, orally before or after having your meals. In a very good medicine, it is given in the fracture cases. When you have fracture, when you have inflammation, there is a tenderness again, and again a very good medicine for tendons, ligaments, injuries. So you can use that. In these rust talks, they have the symptoms like rust talks, you feel better while walking. On the other hand, in brownia, your symptoms are aggravated while you walk. So these are the contradictory symptoms, like better by rest, and your symptoms are aggravated while walking. So in that case, you can use brownia. These depends on the company. So color can be like anything. And Megforce, you must have heard about Megforce. That Megforce is given in like dysmenorrhea, when you have painful periods, when you have severe pain. So similarly, this is given in the Coccydynia when you have severe pain. So this is Megforce, and your symptoms are better by hot compression. So that way you can Megforce. This is in the tablet form. Use even like Megforce dilutions, Megforce mother, and all these medicines link I have provided on description box, so you can buy medicine from there. And hopefully this video can help you. If you find this video knowledgeable, please like, and don't forget to subscribe my channel. Press the bell icon to get notified. Thank you for watching. Thank you for your support.